Yeah, here you are seeing a kidney focused on the screen of the ultrasound. This is the this is the right kidney of a 52 years old patient, measuring 13.7 in length, which is a large length. Up to 11 is considered normal, and the anterior posterior diameter 5.56 up to 5 is normal, so the dimensions are enlarged. Second important thing is we see multiple echogenic areas filling in within these cystic areas that you are seeing. Now these are all calculi. You see dirty shadow from here because of the not that because that this is a gas or a bowel, but rather the beam is not perpendicular while you take the image in this dimension, in this section, subcostally. Okay, then now what are these black areas suggestive of? Now these are all dilated pyramids which can easily be labeled as now this kidney can be labeled as a multicystic or polycystic kidney or multicystic kidney. This area can be labeled as a cyst. This can be a cyst. This can be a cyst. This can be labeled as cyst. Now remember that if you concentrate and then give a sweep to the probe of approximately 90 degrees and then bring it, magnify a bit, and then you will see that these all converge to the central sinus complex or the collecting system. So these are all in fact not cysts, rather they are dilated calyces. These are upper pole dilated calyces, middle region, posterior, and this is this minimal hydronephrosis that you are seeing. And why it is so? It's because of large calculus that is impacted in the pelvic-ureteric junction. This is the calculus, and just see the size of the calculus. This is the parenchyma thinned out, measures only 4.2 mm, and now this is the transverse section of the right kidney, and the calculus seen is extending from the non-dilated renal pelvis up to the proximal ureter here. This is the proximal one. So this, though there are multiple calculi seen within the hydrofluid, dilated calyces, and the reason is that this impacted calculus has led to all these findings as you are seeing, and this linear structure is suggestive of dipping sign of massive hydronephrosis. So thinned out parenchyma, multiple calculi, and you see now you will see some of them are poorly. One of the reasons to explain that why this calculus is giving dirty shadow rather than sharp shadow is that these are poorly calcified, presently poorly calcified calculi. And you see now with the change of angle it is giving sharp shadow, posterior shadow, and you will see now, see with the change of angle again this is giving, now all of these are giving sharp posterior shadows. So the larger one is here. This is the pelvis, and here this is the proximal ureter, and a 26 mm calculus impacted in the in that region, leading to leading to multiple calculation, formation of multiple calculi. Q in the phase of being further calcification, poorly calcified at present. This one, again this one, here you see another, here you see. Most of these are aggregated at the lower pole. Now the upper pole is relatively clear of such calculi. This is the upper pole, this is the upper pole, and so let's see. On color. Now this is the maximum of the parenchyma at the anterior midvision, that is visualized meaning 9.7 mm, but we really do not see any blood flow through that region. Internally it is being perfused. सारो रहना चाहिए, गंदा नहीं खींचना, बाहर काट दो। हाँ जी, सारो को नहीं बजाय खींच रहे, बाहर काटो सा, ऐसे रोको। Now, intersegmental renal artery, the resistive index is 0.60 up to 70 is normal. So PI is also, pulsatile index is also within normal. So this is our case of the day relating to the obstructive uropathy on the right side because of the large calculus in the right pelvic junction, and as well as multiple calculi aggregated in the dilated lower pole calyces, with few seen in the mid calyces. I think with normal renal waveform and pulsatile index. Thank you very much.